A disease, often deadly, targets millions of Canadians one by one. The Canadian Public Health Agency reports that approximately 20% of individuals will experience a mental illness during their lifetime. But a new report from the Fraser Institute shows that waiting times for psychiatric treatment are actually worse now, on average, than wait times for physical healthcare services have ever been. The harsh reality that has doctors and patients fuming on this edition of Fraser TV. I'm Leah Costello. Patients who suffer from mental illnesses know that the toughest thing about treating their conditions is asking for help. Yet, every day, patients are being told they're going to need to wait for specialty care. The queue to see a psychiatrist or other cognitive professional is a long one. Longer still is the wait to receive treatment once a patient has seen a specialist.
From the time a general practitioner gave you a referral to a psychiatrist to the time a psychiatrist actually delivered treatment in 2008, the total wait time was about 18.6 weeks in total, which is a little more than a week longer than it is for the physical specialties that we also measure in waiting your turn.
With the problem of longer psychiatric waiting lists sticking out like a sore thumb, you might think there would be a special effort to improve access to care in that area of medicine. But you might be shocked to learn there isn't. In fact, the government has hardly even noted the problem. In their efforts to reduce waiting times, policymakers are focused on just 5 fairly specific areas of medicine: hips, knees, hearts, cataracts, and cancers. They're important elements, no question, but missing from that list is, well, most of healthcare, including psychiatry.
Why do we focus on hips and knees and cataracts and hearts and cancers and forget about the people who are struggling with mental health issues, which are very real, which have a great impact on individuals? One explanation might be that these people don't often die, and so they don't get counted up in mortality statistics, and they can disappear into quality of life issues, which aren't often well measured in Canada. But I think it's a question we have to ask our government. And there's a broader question within that, which is, why have we forgotten so much of healthcare, and why are we focusing on only 5 small specific areas?
But this researcher says there is hope aside from expecting policymakers to take notice of the wait for psychiatric help. He says a private parallel healthcare system would heal public healthcare in general. It would lower wait times all over the hospital without discriminating against any specialties.
And so more competition and more appropriate financial incentives for patients and providers would assist us in being able to deliver more timely access to these services.
Until then, those suffering from mental issues will have to have a seat. The doctor is in, but he can't see you now. For the complete reports, Waiting Your Turn and Waiting Your Turn Psychiatry, please visit our website at www.fraserinstitute.org. That's it for this edition of Fraser TV. I'm Leah Costello. Thanks for tuning in.